Hello, good morning. Can you hear me and see my screen?
Yes, please.
Okay, good. So, Claude, we are going to start the
Yeah,
uh, class now, and I have started the recording as well.
yeah.
So, today we are going to discuss. So, first of all, I'll welcome to today's online class, and today's class is on the principles of safeguarding in health and social care work. And mm, as your tutor, I'll guide you through the key concepts and we will engage in interactive questions and answers as well. So, today we are going to cover the uh, learning outcome 2, that is, understand how to respond to incidents of abuse or harm. So, these incidents could be at the place of work. So, we will know how to respond. Mm, for example, uh, if you talk about in terms of the principles of person-centered approach. So, for example, in a care home, we need to ensure that each resident care plan is tailored to their individual need, preferences, and history. And uh, are you able to give me the answer uh, person-centered approach in healthcare setting? Uh, are you familiar with the person-centered approach in healthcare setting?
Sorry, repeat again.
Are you familiar with the person-centered approach in a healthcare setting?
No, I'm not getting no idea.
Right. So the person-centered care, what we call it, and in the person-centered care, what happen is we develop the care plan and everything according to the need of that person. So always the centered or the focus is on the person whom we are dealing with. So in health and social care, we always follow the uh, person-centered approach. It's not a journal one approach for everyone, single approach which applies to everyone. No, it's not true. We always follow the person-centered approach. It would be based on the individual person, and according to that person, we'll make our care plan and the strategy and the services which we provide. It should be based on the person-centered approach. So then, because it's asking in the principles of safeguarding in health and social care, that's why I'm telling about the person-centered approach. And also, what we do is we empower the service user. So what we do in that, we encourage the service user or the patient to express their need and make decision about their care as well. So we don't like force everything to the service user or the uh, patient or the client. So we always get their opinion as well, and according to that, we amend the care plan as well. And for example, if someone working as a social carer or like social worker, so how they can actively involve with the client, and how as a service provider, as we are working as a healthcare assistant or uh, like a health like social care for someone, like how do we make them feel that we are giving them importance. We listen them, and we listen their concerns, and um, we we try to like develop the care plan and our strategies to help them and support them how they want. Few things are necessary, like just for example, the medication. So the administration of medication is provided by the is written in the care plan. So we do give the medicines to the client or the service user according to the instructions. But for example, in terms of their own preferences, again, if someone is vegetarian, so if their preference is for the vegetarian meal, so then we will provide them the vegetarian meal or some sort of religious practice. For example, if someone is Muslim, so and if they ask for us to, like, they need to go to pray or they need to offer some prayer, something like that, so then we cannot force them not to pray. It's their individual personal choice, so every person has their individual opinion and choices, so we need to respect that. So this is in that. And what we also do in safeguarding, we do the partnership, we do the collaboration. So what we do is we collaborate with the local law enforcement and community organization, and like what it does, it help the service user, and also like we minimize the harms of, or we do the precautionary steps to minimize the domestic violence as well. And in that also, we also engage the family members as well, of the service user. So what happen if we involve the service user family in care planning and keeping them informed about patient well-being? So that would be like everyone knows what's going on with the service user. Even the service user is also involved into that, and they get like proper care which they are asking for. Then we are accountable. Uh, every person who works in the health or social care industry, they are accountable. So like we have to report the structure for, we have to report the incidents, abuse or neglect, so which we are discussing right now. So if someone is in the situation of harm or abuse, then what we do is we report it, uh, in terms of like sometime it would be in the form of a report, sometime it would be a conversation. So but in the end, we always make the report and we reflect it in our own words. Uh, what exactly happened? We cannot add any story into that or any other additional information. We can't assume anything. What we have seen, we have to reflect it, we have to write it as it is. So I hope you understand these points. And these are the main important points regarding with the principle of safeguarding in health and social care. So, and how to respond to incident or of abuse or harm. So now our next slide is for the key terminologies. Okay. Uh, how do people respond to abuse? What are the example of emotional abuse? What are the six principles of safeguarding? Right. So six principles we also done in the last class. So how do people respond to abuse? So just for example, uh, victims of repeated violence may experience a range of emotions, including sadness, shame, anger, and despair. So this is like usually a person respond to abuse. So uh, will you be able to share your experience, like if a person is a victim of harm, and how do you notice that the person is a victim of some sort of harm or abuse?
Are you asking a question?
Yes.
Okay, repeat again one more time.
Like in your experience, have you
Okay.
ever experienced a person who has gone through with the domestic or any sort of harm or abuse? So what like physical or emotional or psychological um, points you have noticed from that person? Is that ever happen with any of your service user or client?
Yeah, yeah. Of course, where I'm
Right.
working,
Mhm.
I think last month was February, I think so. There was physical abuse where I'm
Oh,
working is is in mental health capacity. Just
right,
yeah, there is one guy just shouting for his neighbor or his colleague or some resident, you know,
right.
shouting. After that, just
Mhm.
he punched him like 2 times. So that
Oh,
one is physical abuse, you know.
it is,
And
yeah.
the staff was there.
Mhm.
Just we get the the accident book. We write down shouting. After
Yeah.
that,
Hmm.
punched 2 times. So that's it. Is that one I can remember right now. So
Yes,
it's
right.
happened.
You are right. And in that case of incident, yeah, you must have written the report, the incident report, what happened, and you may have seen the physical effect on the person's body, if there's physical harm, or the emotional or the psychological harm. We cannot see it, but we can feel it. The person must be like nervous, sad, or something like that. So we need to see for those signs and the symptoms, and then we will act in a way that could help the client or the service user. So it's good like you have experience of that. So this is what we are learning, like how do people respond to abuse. Sometime like the reaction to violence are individual, but some reactions are common. Like victims of violence, especially in case of repeated violence, many people feel sad, shame, and like the example they have provided here. So, for example, in case of an emotional abuse, what happened in case of an emotional abuse? Because we cannot see it physically through our eyes. So, emotional abuse can include actions like shouting at a child, as you mentioned that other resident was shouting at that service user in the same care home. So someone is shouting at a child, or like an adult, and sometimes they call them names or making them the subject of hurtful joke and things like that. So these are in the category of emotional abuse. And there is a huge like a large list of symptoms and actions, but like few of them are like that. And how might emotional abuse impact a child mental health, or an adult? For both, what happen, like it can lead to low self-esteem, anxiety, and depression. The person would go into depression, and we won't see it physically, but we need to see the signs and symptoms. They will feel low, and they won't talk to anyone. They will make them isolated and things like that. And now they are asking us for the what are the six principles of safeguarding. So the six principles are empowerment, prevention, proportionality, protection, partnership, and accountability. So uh, 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 we learned about that individually in the last class. And now, for example, how does the principle of empowerment support safeguarding? So it ensures the individual are supported to make their own decisions and have control over their lives. And it is important that to understand how people respond to abuse, and principles of safeguarding is crucial in ensuring the safety and well-being of those in health and social care settings. So this is your slide 3. Okay, now we have to see that video. Open that one.
I can't hear anything.
Oh, okay. It happened last time as well. So,
Mm.
okay, I'll pause that one. And because I don't know how to change the setting. Right, so we'll leave that
Fine.
one.
If a link is there, we click when we
Yes,
have access
yes,
on Moodle.
yes,
We click over there, we hear something.
yes, you can watch it yourself. Thank you. And now we'll go to the slide number 4. And in the slide number 4, what they are asking us is explain what actions to take if there's evidence of suspected or actual abuse, right? So, in that, we can say that responding to the concerns of abuse and like usually, what happens is a care worker are often the first person to notice the signs of abuse due to their close contact with individuals, those who are requiring care. So, because the care worker or the healthcare assistant, whatever we call them, and they are the first person who notice the signs and symptoms of harms. So they are in a prime position to spot changes in behavior or physical signs that may indicate abuse. For that, for example, if a care worker notices that an individual is covering up unexplained bruises or is upset about financial issues, there could be signs of physical or financial abuse. So, and it's important to remember that these changes might have valid explanation. Therefore, care workers should not jump to conclusion, but should be vigilant and report any concerns according to their organization's safeguarding policies and procedures. So usually this happen as a care worker, and then we need to report the incident. And like again, as I said, that we don't need to write up our own story. We need to explain the things as they occur and as they are like told to us by the service user, exactly as it is. And what happened in that as well. Every organization has their own safeguarding policies and procedures. So as a care worker, we need to follow, or as a health and social care um, person working in the field, we need to follow the specific safeguarding policies and procedures according to their organization. So now, for example, what should a care worker do if they suspect an abuse but are not certain about it? So they should report their concerns according to their organization's safeguarding policies and procedure, allowing the appropriate authorities to investigate further. Like we don't do the investigation by ourselves. There are some responsible person who will do that, and we are not able to ask like some sort of very personal questions, and we are not able to force the person to give the answers because we are not qualified to do that. So there are specific safeguarding lead and some authorities like police or social workers. They would be involved and they will be able to assess the person and do the assessment, and they will provide us with the care plan or anything whatever is required. And why it is important for care worker to follow their organization safeguarding policies when reporting concern. So it is important because the organization policies ensure that the concerns are handled correctly, appropriately, in a manner that protects both the individual and the care worker. Uh, so this is the main points about this slide. And with this one, this is part of your duty of care towards the individual that you support. You will You will usually report your concerns to your manager or a nominated safeguarding lead who will then be tasked with the following it up swiftly. Yes, that's correct. So now, in that manner, what happened? So, like Reporting a concern again. When a care worker suspects abuse, their first step is usually to report the concern to the manager or the nominated safeguarding lead. It is the responsibility of these individuals to follow up on concerns swiftly. Then, for example, in case of emergency, the immediate safety and well-being of the individual are the top priorities. If the individual require medical attention, calling 999 for an ambulance is necessary. If a crime has been committed, the police should be contacted. Additionally, the social services safeguarding team may need to be informed. So it happened if the crime is committed, then we'll do that. And for example, if we need to escalate the concern, if a care worker feels that their concerns are not being taken seriously or dealt with properly, they should escalate the issue to the senior management. If the situation is still not resolved to their satisfaction, external agencies such as social services, the police, or the care quality commission may need to be contacted. The organization visual policies will guide this process. So every organization have their own policies and procedures with the whistle guiding and how to escalate the issue and things like that. So we need to follow that. And if in case that sometime we are not heard properly, then we can contact these departments and recording concerns. So it is essential to record concerns in writing as soon as possible. The account should be factual, accurate, and objective, based on the evidence and observation rather than personal opinions. This is what I told before as well. So then we can say that um, why it is important to record concern in writing. So, because as a care worker, it is necessary for us to record it, to write it. It provides a documented account of the concern, which can be crucial for investigation and ensuring accountability. And then we may say that why should a care worker do if they feel the concern are being ignored by the manager? What then we need to do? So as we told read earlier, that we can contact the different departments like the police, CQC. They should escalate the issue to senior management or external agencies, and again following their the policy of the organization, whistleblowing policy. And then, for example, if there is an abuse, so for example, uh, what we will do in case of that. There's the next slide. Yes, okay. So now there the next bullet point. If an individual discloses to you that they have been abused, right? Okay. When an individual discloses that they have been abused, the first step is to show sensitivity and provide reassurance. It's important to listen to them, affirm them that they did the right thing by speaking up, and reassure them that the abuse was not their fault. However, care workers should not make promises they cannot keep, such as promising to keep the information secret. They must explain that it is their duty to report the abuse to the prevent abuse to the team, the senior management, and so like for example, in terms of like any concern, if I have any concern regarding any service user, so what we do is we tell them that we may need to share the information to some external or multidisciplinary team, even to my manager or senior person, so that they can report it properly and help could be provided to you. So we need to take the consent, and then in sometimes we don't need to take the consent if it's a immediate harm to the person or to anyone around them, but usually we take the consent and then we follow it properly. So Care workers should always follow the organization agreed upon procedures for reporting to disclose of any abuse. All disclosures should be reported as soon as possible in accordance with these procedures. If the organization or its management is implicated in the abuse, care worker may need to report their concerns to external agencies such as the police, uh, CQC, social services, the local authority. So we need to do that, and we need to avoid the person investigation. It's important for care worker to refrain from investigating the allegation themselves or confronting the alleged abuser. This is the responsibility of professions such as the police or the local authority or the social services. Then we have to record it. Care workers should make a factual written statement of the disclosure as soon as possible. The statement should be accurate and free of personal views, and should be signed and dated. There are a few of the important points that we need to do. Then we will ask that why it is important not to investigate the allegation by yourself. So investigating allegations is the job of professionals, and professional investigation, like they can do it properly because they are trained into that. We are not trained into that, so we are not authorized to do that. Anything which we are not trained on, we cannot practice it, or in some time we need the like license, or we need the insurance as well. So we are not qualified to do that, so we cannot do it. What's in the next slide? Document or preserving evidence. Okay, so if there is an evidence of abuse, you should try to ensure that that is preserved as long as this does not put you at risk. Okay, so what we will do in case of any abuse which is evident, so we will preserve the evidence. If there's evidence of abuse, it's important to try to preserve it as long as doing so does not put you at risk. This could include physical evidence such as clothing or objects related to the incident. Then we need to document the evidence, document any evidence of abuse that you have observed or heard. This include taking photographs of injuries, recording written accounts of incidents, or noting any changes in behavior. Keep this information in a safe and secure place. Then support the person. Offer support and reassurance to the person who has been abused. Encourage them to seek help and support from professionals such as counselors, or any person like the social worker. So they could involve those people. And then like as a carer, it's our duty sometimes to follow up with the appropriate authorities to ensure that the case is being investigated and that the person is receiving the support and services they need. So who will do that? The manager or the responsible safeguarding lead will investigate further or get in contact with the local authorities to know what's the output, what's the outcome. And then there are some legal obligations. It's important to remember that reporting suspected or actual abuse is a legal obligation in many organizations and in many countries, and failing to report can result in legal consequences. Therefore, it is important to take action as soon as possible if you suspect abuse is occurring. So these are about that one. And again, if we say that, if we ask that why it is important to document evidence of abuse, so it is important because it is crucial for supporting the investigation and ensuring that the appropriate actions are taken to protect and support the victim. Okay, and one more question would appear maybe. What should you do if you are unsure when a situation constitutes abuse, and you should report your concern according to your organization policy and procedure. It's better to report and have it investigated than to overlook potential abuse. And if we understand the importance of documenting and preserving evidence, care worker can play a critical role in safeguarding individual and ensuring that abuse is addressed appropriately. This is about the slide 7. We have slide 8. What we have here, need to evaluate the roles of practitioners and agencies involved in safeguarding. Okay, so there are many um, every person has their own role in that safeguarding, and what are the agencies involved in safeguarding. So identification and reporting, assessment and investigation. Right, right. Okay. So now, for example, identification and reporting. Uh, so practitioners in the field like healthcare workers, social work people, education and in law enforcement are often on the front line when it comes to identify signs of abuse or neglect. They have a crucial role in observing and recognizing the indicators of potential harm. Once they suspect abuse, they are responsible for reporting the concern to the appropriate authorities. Uh, right, and then we have assessment and investigation. So agencies responsible for safeguarding take the lead, like such as child protective services or adult protective services are responsible for assessing the risk of harm to the individual and the investigating any allegation of abuse or neglect. They work closely with practitioners such as healthcare provider or social worker. So this is the information, and what would happen if we do that? The goal is to determine the allegation and the level of risk to the individual, which will inform the which will like be able for us to make an appropriate like intervention or support plan or care plan, something like that. So this is the benefit of it as well. So then we may ask like why it is important for for a practitioner to report the concern about abuse or neglect. So again, reporting is like crucial for initiating investigation and intervention that can protect the individual from further harm. And if we understand the role of practitioner and agencies in safeguarding, then as a care worker, um, like we will understand the topic and the procedure properly. Then in the side 9, we have intervention and support, legal and regulatory action, and prevention and education. So now, for example, agencies responsible for safeguarding, such as local authorities, play a crucial role in providing intervention and support to protect vulnerable individuals from harm. This may include range of services such as providing temporary shelter for individuals who need to escape abusive situation. Then we may have the situation that arranging for medical or mental health care to address physical injuries or psychological trauma resulting from abuse. Then we may have offering counseling or therapy to help individual cope with the effects of abuse and rebuild their life. Then the legal and regulatory action, why we take those to ensure the safety and well-being of vulnerable individuals. Safeguarding agencies or the local authority may take legal or regulatory action, which could be seeking court order and such as restraining orders to protect individuals from their abusers or guardianship order to ensure proper care for those who cannot care for themselves, and revoking license or certification of professionals who have engaged in abusive or neglectful behavior to prevent them from causing further harm. It happened in the United Kingdom, and we have the case studies and the case laws for that. That the service provider or the care workers, they were held responsible for few of the negligence, or any they did some harm to the service user. So mm, the next part is prevention and education. So prevention and education. Okay. Preventing abuse or neglect is as important as reporting to it. Practitioners and agencies play a role in prevention through education and awareness raising activities, such as providing training to professionals, such as healthcare providers or teachers, on how to identify and report signs of abuse, and offering community education programs to raise public awareness of the signs of abuse and neglect and the importance of reporting concerns. Now, in that, we may ask the question like, why it is important for agencies to provide support and intervention services to individuals who have experienced abuse or neglect. So these services are essential for protecting individuals from further harm, addressing their immediate needs, and helping them recover and rebuild their life. Then, for example, how can education and awareness raising help prevent abuse and neglect? It's for both the service user and the service provider as well, by increasing the understanding of science and abuse and the importance of reporting concern. Education and awareness raising can empower individuals and communities to take action and prevent abuse before it occurs. So these are the important points. Now what we have in the next slide: safeguarding adult boards. Okay, so safeguarding adult board. So now, for that, each local authority is responsible for establishing a safeguarding adult board in their area, and the composition of a safeguarding adult board must include representative from a key organization, including the local authority, the police, specifically the chief officer, and the clinical commissioning group (CCGs), and other members may also be included depending on the specific need and structure of the local area. So now, what's the role of the safeguarding adult board? The primary role of safeguarding adult board is to lead and oversee adult safeguarding efforts within their locality. Key responsibility of the safeguarding adult board may include publishing strategic and annual reports to outline their safeguarding activities and goals, commissioning safeguarding adult reviews in a serious cases of abuse or neglect, uh, and reviews. Safeguarding adult reviews are conducted to learn from cases and improve future safeguarding practices. As I mentioned earlier, that there are few of the case laws and the cases which held in the United Kingdom. So, based on those cases, they make their decision for to prevent the future harm, ensuring that agencies within the area keep in partnership to effectively safeguard adults from abuse and neglect. And then what's next? Now, like the students may ask the question, or like a service user, or even the practitioner, they may ask that why it is important for the safeguarding adult board to include representative from the local authority, the police, and the CCGs. Why it is important? Because it ensures a collaborative approach to safeguarding, with each organization bringing its expertise and resources to address abuse and neglect effectively. And then we may ask, what is the purpose of commissioning safeguarding adult reviews? So, safeguarding the SARS are conducted to learn from serious cases of abuse or neglect and to improve safeguarding practices and prevent future incidents. And if we understand the role and responsibilities of safeguarding adult board, then we would be able to appreciate the collaborative and strategic effort required to protect vulnerable adults from abuse and neglect. So that's why it's important for a care worker to know these policies, principles, and procedures. Then we have social services in the next slide. Okay, so social services play a critical role in safeguarding vulnerable individuals. Their responsibilities include investigating and concerns related to the safeguarding of vulnerable individuals. This involves looking into reports of abuse or neglect to determine if there is a risk to individual safety and well-being. Then implementing intervention to protect individuals from harm. This can include arranging for temporary shelter, coordinating with the law enforcement, or providing support services. Social services are usually divided into two teams. Um, an adult team that focuses on the safeguarding adults who are at risk of abuse or neglect, and a children team that coordinates or protecting the children from harm. So basically, social work teams are divided into two teams. One is for the adult and one is for the children. So um, health and social care organization, like what happened in that, all organizations that provide health or social care services uh, have a responsibility to protect the individual who receive their services from abuse and neglect. And to fulfill this responsibility, they must have agreed ways of working in place, such as safeguarding policy, a document that outlines the organization approach to preventing and responding to abuse and neglect. Then they must have a blowing policy. So whistleblowing policy is with every organization. They have it, whether it's health or social care uh, organization or any other organization we are working with. They have is the whistleblowing policy of their own. Um, uh, a policy, what it do, whistleblowing policy, a policy that encourages the staff to report any concern about abuse or neglect without fear of reprisal. Then in the care and health and care industry, care plans are important. Individualized care plans that address the specific need and risk of each person receiving care, that is important. Then the risk assessment. What risk assessment is, evaluation of the potential risk to an individual's safety and well-being and the measures in place to mitigate those risks. Now, someone may ask that why it is important for social services to have separate team for adult and children. So the answer would be it allows for specialized focus and experience and expertise in addressing the unique need and risk associated with safeguarding adults and children. For example, the legislation or the procedure would be different. For example, in terms of children, there might be a child in need threshold, or in terms of an adult, we cannot say that a child in need. So it would be an adult in need, but there would be different procedure, like the sections would be different. Um Sometime we use the section 42, sometime we use the section 17, so it depends. And uh, like what would be the role of care plan and risk assessment in safeguarding? So they provide a structured approach to identifying and addressing the specific needs and risk of individual, ensuring that appropriate measures are in place to protect them from abuse or neglect. So this is with that. And we have Care Quality Commission, right? In addition to social services and health and social care organization, the Care Quality Commission (CQC) and the police also play a vital role in safeguarding vulnerable individuals and what their responsibilities are. The Care Quality Commission (CQC). The CQC is an independent regulatory body responsible for governing and regulating health and social care services in England. Its role in safeguarding include monitoring. Uh, the CQC regulatory monitors health and social care services to ensure they comply with essential standard of quality and safety. Then they also do the inspecting. The CQC conducts inspections of services to assess their performance, including how well they protect individuals from abuse and neglect. Uh, if you go to the CQC website, then each care home or the place which is related with the health and social care is rated. There is grading. So we can check the grading from the CQC website as well. And then they may take action. If the CQC identifies that a service is not meeting required standard, it can take enforcement action to ensure that improvements are made. Uh, and now we have the police. The police play a crucial role in responding to and investigating allegations of abuse. Their responsibilities include investigating allegation. When allegations of abuse are reported, the police investigate to determine if a crime has been committed and to gather evidence for potential prosecution. Then what it also does, protecting the individual. The police work to protect individuals who are at risk of harm from abuse or neglect. Then police also raise awareness. The police also play a role in raising awareness of abuse, educating the public and professional about the signs of abuse and the importance of reporting concerns. There are a lot of educational campaigns and educational material available on different government website, and there is a paid promotion as well through advertisement, like for example stop smoking and about the um, what we can say that the harms and the neglect or physical, mental, emotional abuses. So there are resources available as well, and as a care worker, our organization always give us training onto that. So we should always attend the mandatory training. Now, uh, why it is important for CQC to monitor and inspect health and social care services? So because regular monitoring and inspection help ensure that the service meet essential standards of quality and safety, including protecting individuals from abuse and neglect. And how do the police contribute to the prevention of abuse? The police contribute to prevention by investigating allegation, protecting individual at risk, and raising awareness about abuse and importance of reporting concerns. So what we do generally is, if we understand the roles of the CQC and the police in safeguarding, and then as a care worker or person who's working in the care industry or health or care industry, they can appreciate the multi-agency approach to protect vulnerable individual from abuse and neglect. So this is about CQC. Okay, now we have the references. And any questions so far? We have one chat.
No, it's fine.
Okay, right. So, so no one has any question. Mm, right. So If there's no question, then um, we'll conclude today's lecture. And today's lecture was on the principle of safeguarding, and that I want to emphasize the crucial role that each one of us play in protecting vulnerable individuals from abuse and neglect. And it's not the safeguarding is not only for a certain individual, like it's not only for the uh, people who are involved in the care industry or health and social care industry. It's everyone's responsibility. Whether I'm a tutor, I'm teaching, so it's my responsibility to um, look for any abuse or harm happen to my students or anything like that. If we are in a care industry, then we need to look for the health and care service user which we are serving them, and we need to know the whistleblowing policy, and we need to take care of our uh, like ourselves and the individuals we are working with. And whether we are a practitioner, a care worker, or a future uh, leader in health or social care, and we need to have compassion and commitment to follow the proper procedures, and which can make a profound difference in someone's life. And again, safeguarding is everyone's responsibility. It's about working together, being proactive, and always prioritizing the safety and well-being of those we serve. And again, that it's with the slides and everything, you won't learn everything. You need to do the self-reading as well. So because these are the very important topics, not on this specific level, with every level, like will it be level 3, 4, 5, 6, even at master's level, you will again like go through these sort of topic, because these are the key concepts of safeguarding. So it's better if we will learn the basics about that, the role of care quality commission, the role of the police, or like the multi-agency work, the interdisciplinary work. So we should know these, and we should know the policies which are in our organization for whistleblowing, and we should know how to report the incident, how to write the incidents practically. So if we are not sure about it, then you may look or ask from your particular employer that I need guidance about these specific things, and then you will be able to learn more. So practically we do that. So like for example, at the college, wherever I teach, so every college has their own designated safeguarding lead, and they have their own policies, but the basics are the same. So whether it would be in care industry or like for me, we don't have that much personal interaction with the student. So it would be different from my side for whistleblowing and reporting and uh, mm, like reporting and following the procedure. It would be a different scenario for me. But for as a care worker, it would be completely different procedure. So I hope that you understand today's important point. And again, if you have any question, you can ask.
No, it's fine.
Fine, okay. Thank you. So we'll finish today's lecture then, and uh, we'll get in contact in the next class next week. So we have covered the learning outcome 1 and learning outcome 2. So each unit has 4 learning outcomes, and by next Saturday and Sunday, we will cover
Okay.
all 4 of them, and we'll see each other next week then.
Yes, thank you.
Thank you. Thank you, everyone.
Thank
Take
you.
care. Bye.
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 Bye.